Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 25 practice NCLEX questions. Without the way, let's get started.
The nurse explains to the parents of a 1-year-old child admitted to the hospital in sickle cell crisis that the local tissue damage the child has on admission is caused by which of the following? 1. Autoimmune reaction complicated by hypoxia. 2. Lack of oxygen in the red blood cells. 3. Obstruction to circulation. 4. Elevated serum bilirubin concentration. The correct answer is 3. Characteristic sickle cells tend to cause log jams in capillaries. This results in poor circulation to local tissues, leading to ischemia and necrosis. The basic defect in sickle cell disease is an abnormality in the structure of the red blood cells. The erythrocytes are sickle-shaped, rough in texture, and rigid. Sickle cell disease is an inherited disease, not an autoimmune reaction. Elevated serum bilirubin concentrations are associated with jaundice, not sickle cell disease. A prima gravida client with class 2 heart disease who is visiting the clinic at 8 weeks gestation tells the nurse that she has been maintaining a low-sodium, 1,800 calories diet. Which of the following instructions should the nurse give the client? 1. Avoid folic acid supplements to prevent megaloblastic anemia. 2. Severely restrict sodium intake throughout the pregnancy. 3. Take iron supplements with milk to enhance absorption. 4. Increase caloric intake to 2,200 calories daily to promote fetal growth. The correct answer is 4. The client can continue a low-sodium diet but should increase the caloric intake to 2,200 calories daily to provide adequate nutrients to support fetal growth and development. Folic acid supplements, a standard component of care, are used to prevent folic acid deficiency, which is associated with megaloblastic anemia during pregnancy. Severe restriction of sodium intake is not recommended because sodium is necessary to maintain fluid volume. Iron supplements should be taken with acidic foods and fluids for maximum absorption. Milk decreases the absorption of iron. One of the important aspects of the client's rights is the right to treatment in the least restrictive environment. The nurse observes this principle when making which decisions. Select all that apply. 1. Referring a client to a group home or supervised apartment living. 2. Releasing client information to a primary care physician or a relative. 3. Placing a client in seclusion or restraints. 4. Respecting the client's right to accept or refuse treatment. 5. Placing a committed client in a daily outpatient group or a weekly self-help group. The correct answers are 1, 3, and 5. Group homes, apartment programs, seclusion, restraints, day treatment programs, and self-help groups all involve degrees of restriction and supervision. Releasing information about the client is governed by legislation and rules of confidentiality. Accepting or refusing treatment is governed by laws related to informed consent. The nurse is teaching the parents of a child with sickle cell disease. To instruct them on how to prevent sickle cell crisis, she should include which instruction? 1. Restrict the child's fluid intake to less than 1 quart per day. 2. Drink at least 2 quarts of fluids per day. 3. Stay away from other teenagers. 4. Avoid physical activity. The correct answer is 2. Increasing fluid intake and being well hydrated will help prevent cell stasis in the small vessels. Restricting fluids causes stasis of red blood cells and promotes obstruction and increases a chance of sickling with hypoxia and pain to the part that is involved. Clients with sickle cell disease should stay away from others who have infections. When the spleen of a client who has sickle cell disease has become fibrotic and non-functional, the client is more susceptible to infections. Clients with sickle cell disease should not avoid physical activity as long as the client stays well hydrated. On arrival at the emergency department, a client tells a nurse that she suspects that she may be pregnant but has been having a small amount of bleeding and has severe pain in the lower abdomen. The client's blood pressure is 70/50 and her pulse rate is 120 beats per minute. The nurse notifies the primary health care provider immediately because of the possibility of 1. Ectopic pregnancy. 2. Abruptio placentae. 3. gestational trophoblastic disease. 4. Complete abortion. The correct answer is 1. The client's signs and symptoms indicate a probable ectopic pregnancy, which can be confirmed by ultrasound examination or by cholecystosis. The primary healthcare provider is notified immediately because hypovolemic shock may develop without external bleeding. Once the fallopian tube ruptures, blood will enter the pelvic cavity, resulting in shock. Abruptio placentae would be manifested by a board-like uterus in the 3rd trimester. Gestational trophoblastic disease would be suspected if the client exhibited no fetal heart rate and symptoms of pregnancy-induced hypertension before 20 weeks gestation. A client with complete abortion would exhibit a normal pulse and blood pressure with scant vaginal bleeding. A 14-year-old girl with sickle cell disease has her 4th hospitalization for sickle cell crisis. Her family is planning a ski vacation in the mountains. What should the nurse tell the parents? 1. Encourage them to go on the trip. 2. Go on the trip, but find a sitter for the 14-year-old. 3. Suggest the trip be postponed until next year. 4. Explain that the high altitude may cause a crisis. The correct answer is 4. High altitude causes deoxygenation, which might precipitate a crisis. In clients with sickle cell anemia, cells sickle when the client experiences any situation where increased demand for oxygen is needed, such as an infection or dehydration, or when low oxygen concentration is experienced, such as in high altitudes or deep-sea diving. Crises can commonly be prevented by maintaining hydration. It would be unsafe to encourage the family, or to say nothing about taking client to high-altitude areas, but giving the parents adequate information will allow them to make an appropriate decision. Postponing the trip or leaving the child at home does not address the immediate concern for the child's health. A client diagnosed with schizophrenia is being switched to risperidone long-acting injection, which is Risperdal Consta. He is told that he will remain on his oral dose of risperidone daily for approximately 1 month. The client says, "I didn't have to take pills when I was on fluphenazine decanoate shots in the past." The nurse should tell the client, 1. Taking fluphenazine orally and by injection would not be as effective as the injection alone. 2. Risperdal Consta is less potent than fluphenazine decanoate. 3. The doctor didn't believe you would take both the pills and fluphenazine decanoate. 4. Risperdal Consta initially takes a little longer to reach the ideal blood level. The correct answer is 4. Achieving a therapeutic blood level is a slower process with risperidone long-acting injection. Oral fluphenazine does not decrease the effectiveness of the intramuscular version and might increase the incidence of adverse effects. There is no evidence that the potency of the 2 medications is significantly different. Blaming the client for non-compliance with these 2 medications is inappropriate. Which of the following should the nurse include when completing discharge instructions for the parents of a 12-month-old child diagnosed with Kawasaki disease and being discharged home? 1. Offer the child extra fluids every 2 hours for 2 weeks. 2. Take the child's temperature daily for several days. 3. Check the child's blood pressure daily until the follow-up appointment. 4. Call the primary healthcare provider if the irritability lasts for 2 more weeks. The correct answer is 2. The child's temperature should be taken daily for several days after discharge because recurrent fever may develop. Offering the child fluids every 2 hours is not necessary. Doing so increases the child's risk for CHF. Checking the child's blood pressure at home usually is not included as part of the discharge instructions because by the time of discharge, the child is considered stable and the risk for cardiac problems is minimal. Most children with KD recover fully. Irritability may last for 2 months after discharge. The nurse is caring for a client with a suspected diagnosis of hypercalcemia, which sign/symptom is an indication of this electrolyte imbalance. 1. Twitching. 2. Positive Trousseau sign. 3. Hyperactive bowel sounds. 4. Generalized muscle weakness. The correct answer is 4. Generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau sign, and hyperactive bowel sounds are signs of hypocalcemia. At an outpatient visit 3 months after discharge from the hospital, a client says he has stopped his olanzapine even though it controls his symptoms of schizophrenia better than other medications. I have gained 20 pounds already. I can't stand anymore. Which response by the nurse is most appropriate? 1. I don't think you look fat. Why do you think so? 2. I can help you with a diet and exercise plan to keep your weight down. 3. You can be switched to another medicine. 4. Your weight gain will level off if you stay on the medication 3 more months. The correct answer is 2. Helping the client control his weight is the most appropriate approach. The nurse's contradiction of the client's statement is inappropriate. Most atypical antipsychotics cause weight gain and are not a solution to the weight gain. There is little evidence that weight gain from taking olanzapine decreases with time. A 16-month-old child diagnosed with Kawasaki disease is very irritable, refuses to eat, and exhibits peeling skin on the hands and feet. The nurse should do which of the following first? 1. Apply lotion to the hands and feet. 2. Offer food the toddler likes. 3. Place the toddler in a quiet environment. 4. Encourage the parents to get some rest. The correct answer is 3. One of the characteristics of children with KD is irritability. They are often inconsolable. Placing the child in a quiet environment may help quiet the child and reduce the workload of the heart. Although peeling of the skin occurs with KD, the child's irritability takes priority over applying lotion to the hands and feet. Children with KD usually are not hungry and do not eat well regardless of what is served. There is no indication that the parents need rest. Additionally, in this situation, the child takes priority over the parents. The nurse is caring for a client with a nasogastric tube that is attached to low suction. The nurse monitors the client closely for which acid-base disorder that is most likely to occur in this situation. 1. Metabolic acidosis. 2. Metabolic alkalosis. 3. Respiratory acidosis. 4. Respiratory alkalosis. The correct answer is 2. Rationale. The loss of gastric fluid via nasogastric suction or vomiting causes a metabolic condition. This also results in an alkalotic condition due to the loss of hydrochloric acid through gastrointestinal fluid losses. Also, the options denoting a respiratory problem, respiratory acidosis and respiratory alkalosis, can be easily eliminated. A child with Kawasaki disease is receiving low-dose aspirin. The mother calls a clinic and states that the child has been exposed to influenza. Which recommendations should the nurse make? Select all that apply. 1. Increase fluid intake. 2. Stop the aspirin. 3. Keep the child home from school. 4. Watch for fever. 5. Weigh the child daily. The correct answers are 2 and 4. Aspirin needs to be stopped because of its possible link to Reye's syndrome. Additionally, the parents need to watch for signs and symptoms of influenza. Children with influenza, frequently present with fever, cold symptoms, and gastrointestinal symptoms. Increasing the child's fluid intake and weighing the child daily are not needed at this time because the child is not ill. Keeping the child home from school is not necessary because the child is not ill and has already been exposed. A 79-year-old woman is brought to the outpatient clinic by her daughter for a routine medication evaluation. The daughter reports that her mother is quite stable and has no adverse effects from the risperidone she is taking. Then the daughter says, "I just think my mother could be even better if she was on a larger dosage. My son takes 1 milligram of Risperdal every day, and my mother is only on 0.5 milligrams. What is the most helpful response by the nurse? 1. Maybe your son is sicker than your mother is. 2. We can increase your mother's dosage if you want. 3. Older clients generally need only 1/3 to 1/2 the dose of younger people. 4. I'm not seeing any symptoms of illness in your mother. Let's wait until the next visit." The correct answer is 3. Elderly clients are typically on lower dosages of antipsychotic medications due to the metabolic changes of aging. Comparing dosages is not relevant. Each client is unique in metabolizing medications. Changing medication dosages is based on an assessment of illness symptoms and the adverse effect profile, not on family preferences. Urging the daughter to wait discounts her concerns and gives no rationale for waiting. When developing a plan of care for a newly admitted 2-year-old child with a diagnosis of Kawasaki disease, which of the following should be the priority? 1. Taking vital signs every 6 hours. 2. Monitoring intake and output every hour. 3. Minimizing skin discomfort. 4. Providing passive range of motion exercises. The correct answer is 2. Cardiac status must be monitored carefully in the initial phase of KD because the child is at high risk for congestive heart failure. Therefore, the nurse needs to assess the child frequently for signs of CHF, which would include respiratory distress, and decreased urine output. Vital signs will be obtained more often than every 6 hours because of the risk of CHF. Although minimizing skin discomfort would be important, it does not take priority over monitoring the child's hourly intake and output. Passive range of motion exercises will be done if the child develops arthritis. A multigravida client diagnosed with probable ruptured ectopic pregnancy is scheduled for emergency surgery. In addition to monitoring the client's blood pressure before surgery, which of the following would the nurse assess? 1. Uterine cramping. 2. Abdominal distension. 3. Hemoglobin and hematocrit. 4. Pulse rate. The correct answer is 4. Fallopian tube rupture is an emergency situation because of extensive bleeding into the peritoneal cavity. Shock soon develops if precautionary measures are not taken. The nurse readying a client for surgery should be especially careful to monitor blood pressure and pulse rate for signs of impending shock. The nurse should be prepared to administer fluids, blood, or plasma expanders as necessary through an intravenous line that should already be in place. Because the fertilized ovum has implanted outside the uterus, uterine cramping is unlikely. However, abdominal tenderness or knife-like pain may occur. Abdominal fullness may be present, but abdominal distension is rare unless peritonitis has developed. Although the hemoglobin and hematocrit may be checked routinely before surgery, the laboratory results may not truly reflect the presence or degree of acute hemorrhage. Which of following should the nurse perform to help alleviate a child's joint pain associated with rheumatic fever? 1. Maintaining the joints in an extended position. 2. Applying gentle traction to the child's affected joints. 3. Supporting proper alignment with rolled pillows. 4. Using a bed cradle to avoid the weight of bed linens on joints. The correct answer is 4. For a child with arthritis associated with rheumatic fever, the joints are usually so tender that even the weight of bed linens can cause pain. Use of a bed cradle is recommended to help remove the weight of the linens on painful joints. Joints need to be maintained in good alignment, not positioned in extension, to ensure that they remain functional. Applying gentle traction to the joints is not recommended because traction is usually used to relieve muscle spasms, not typically associated with rheumatic fever. Supporting the body in good alignment and changing the client's position are recommended, but these measures are not likely to relieve pain. As hospital-based care has become more oriented to crisis intervention, criteria for admission to the hospital have also changed. Which clients have priority for admission to an acute care facility? Select all that apply. 1. Clients who live alone. 2. Clients who are acutely psychotic. 3. Clients who are acutely depressed. 4. Clients who are dangerous to self or others. 5. Clients who are not sleeping and have a lack of appetite. 6. Clients who are not complying with medication regimens. The correct answers are 2 and 4. Safety issues, including protection of the client and others, are the priorities for admission. Acute psychosis commonly involves issues of safety. Living alone is not a sufficient reason to be admitted to a healthcare facility. Depression, insomnia, lack of appetite, and noncompliance are important issues, but not sufficient for admission unless combined with one of the other criteria. A 36-year-old multigravida client is admitted to the hospital with possible ruptured ectopic pregnancy. When obtaining the client's history, which of the following will be most important to identify as a predisposing factor? 1. Urinary tract infection. 2. Exercise during pregnancy. 3. Episodes of pelvic inflammatory disease. 4. Use of estrogen-progestin contraceptives. The correct answer is 3. Anything that causes a narrowing or constriction in the fallopian tubes, so that a fertilized ovum cannot be properly transported to the uterus for implantation, predisposes an ectopic pregnancy. Pelvic inflammatory disease is the most common cause of constricted or narrow tubes. Developmental defects are other possible causes. Ectopic pregnancy is not related to urinary tract infections. Exercise during pregnancy is not associated with ectopic pregnancy. Progestin-only contraceptives and intrauterine devices have been associated with ectopic pregnancy. The primary health care provider prescribes pulse assessments through the night for a 12-year-old child with rheumatic fever who has a daytime heart rate of 120. The nurse explains to the mother that this is to evaluate if the elevated heart rate is caused by 1. The morning digitalis. 2. Normal activity during waking hours. 3. A warmer daytime environment. 4. Normal variations in day and evening hours. The correct answer is 2. An above-average pulse rate that is out of proportion to the degree of activity is an early sign of heart failure in a client with rheumatic fever. The sleeping pulse is used to determine whether the mild tachycardia persists during sleep or whether it is a result of daytime activities. The environmental temperature would need to be quite warmer before it could influence the heart rate. Digitalis lowers the heart rate, so the rate would be decreased during the daytime. A client diagnosed with undifferentiated schizophrenia gained 50 pounds in 6 months while taking olanzapine. After seeing her psychiatrist, who changed the medication to ziprasidone, the client tells a nurse, "I don't want to take this ziprasidone either. I can't gain any more weight." Which response by the nurse is most appropriate for this client? 1. Ziprasidone causes less weight gain than the other atypical antipsychotics. 2. We can give it to you as an injection rather than in capsule form. 3. Abnormal movements are not as common with ziprasidone. 4. You can take it just before bedtime, so you won't need a snack. The correct answer is 1. Most clients experience less weight gain when taking ziprasidone. Although ziprasidone can be administered intramuscularly, it can be used only on an as-needed basis by this route. Ziprasidone has fewer extrapyramidal side effects, but that is not this client's major concern. Ziprasidone is better absorbed when taken with food, so a bedtime snack is needed. A multigravida client is admitted to the hospital with a diagnosis of ectopic pregnancy. The nurse anticipates that, because the client's fallopian tube has not yet ruptured, which of the following may be prescribed: 1. Progestin contraceptives. 2. Medroxyprogesterone. 3. Methotrexate. 4. Diphyline. The correct answer is 3. Because the fallopian tube has not yet ruptured, methotrexate may be given, followed by leucovorin. This chemotherapeutic agent attacks the fast-growing zygote and trophoblast cells. RU-486 is also effective. A hysterosalpingogram is usually performed after chemotherapy to determine whether the tube is still patent. Progestin-only contraceptives and medroxyprogesterone are ineffective in clearing the fallopian tube. Diphyline is a bronchodilator and is not used. Which of the following initial physical findings indicate the development of carditis in a child with rheumatic fever? 1. Heart murmur. 2. Low blood pressure. 3. Irregular pulse. 4. Anterior chest wall pain. The correct answer is 1. In rheumatic fever, the connective tissue of the heart becomes inflamed, leading to carditis. The most common signs of carditis are heart murmurs, tachycardia during rest, cardiac enlargement, and changes in the electrical conductivity of the heart. Heart murmurs are present in about 75% of all clients during the first week of carditis, and in 85% of clients by the third week. Signs of carditis do not include hypotension or chest pain. The client may have a rapid pulse, but it is usually not irregular. The nurse is assessing a client who is taking an antipsychotic medication. Which of the following symptoms is uniquely indicative of neuroleptic malignant syndrome, NMS, and requires immediate attention. 1. Very high temperature. 2. Muscular rigidity. 3. Tremors. 4. Altered consciousness. The correct answer is 1. Muscular rigidity, tremors, and altered consciousness are symptoms of other movement disorders as well as NMS, such as extrapyramidal side effects. High temperature is unique to NMS, particularly when seen with the other 3 symptoms. NMS is potentially fatal and needs immediate attention. When teaching a client with chronic obstructive pulmonary disease, to conserve energy, the nurse should teach the client to lift objects. 1. While inhaling through an open mouth. 2. While exhaling through pursed lips. 3. After exhaling but before inhaling. 4. While taking a deep breath and holding it. The correct answer is 2. Exhaling requires less energy than inhaling. Therefore, lifting while exhaling saves energy and reduces perceived dyspnea. Pursing the lips prolongs exhalation and provides the client with more control over breathing. Lifting after exhaling, but before inhaling, is similar to lifting with the breath held. This should not be recommended because it is similar to the Valsalva maneuver, which can stimulate cardiac arrhythmias.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.